Hey everybody, welcome to my channel. I'm Dr. P, a board certified OBGYN, and today we're talking about, can thyroid imbalance cause depression? By the end of this video, you'll have a better understanding about thyroid imbalances. You'll know what your blood results actually are telling you. You'll understand the link between thyroid disorders and depression, and I'll give you practical tips of how to manage your thyroid concerns. So what is thyroid imbalance? In general, when we think about our hormones, we have so many hormones all over our bodies. They have different purposes, they do different things, they change all the time, they fluctuate all the time. And so because of that, our hormones are constantly in flux. They go up, they go down. They influence each other, which means sometimes you can have a thyroid issue that is being caused by an ovulatory issue or a hormone in the brain that is not being regulated well and causes your thyroid to be imbalanced. And so it is a very complex network of hormonal changes that in the end makes us feel a little bit out of whack. It makes us feel as though our hearts may be racing. We may have changes in our energy and mood. We may have skin problems. We can have a ton of changes that we feel that are all due to the hormonal changes that are happening inside. And so your thyroid is huge as a female. It is so huge that one of the first tests that we typically will order, if you come in and say, listen, my pelvis doesn't feel a certain way or my cycles are irregular, we will check your thyroid, this organ. Let me show you this organ that looks like this on our plush, but it is really a life size or maybe a little bit too big. It's a tad bit bigger than what we would consider to be normal, but we have this organ roughly the size that is right beneath our skin in our neck region that is important and behind what our energies, our metabolism, or female reproductive system, all of this, how it all functions, your thyroid. And so let's talk about some of the main thyroid disorders that we know of. The first is hypothyroidism. Hypo means low. It means that your thyroid is not producing as much hormones as it needs to maintain your normal function. And so with hypothyroidism, symptoms are commonly that of feeling cold, where you're just like, it doesn't matter how warm it is, I still feel cold. My fingers are cold, my toes are cold, I have goosebumps all of the time. This is because your metabolism, which is controlled by your thyroid organ, is much lower than it ought to be. So you're not producing energies, and those energies are often in the form of heat. And so you're cold all the time. And it's not because it's cold, it's because your thyroid is imbalanced. It also may mean that you gain an excessive amount of weight just by looking at a cake. I know I'm joking, but those with hypothyroidism oftentimes will have a very hard time maintaining their weight and a very easy time gaining weight. And this weight gain is oftentimes not where you want it to be. This is often in your abdomen, your midsection, and it comes on very easy and it's very hard to come off. And this is regardless of your diet and exercise plans as well. With hypothyroidism, we also know you may have very dry skin, brittle skin. You can moisturize and you feel no differently afterwards because of your thyroid. It also may lead to mood changes. And now, because we're talking about depression and thyroid disorders, I can tell you that a majority of those who have a hypothyroid problem, you're at increased risk of having depressive symptoms. So the same way that hypothyroidism may slow your body down, may slow your system down, it slows down the energies and the thoughts and the processes in your mind so that it's more difficult for you to achieve normal cognitive thinking as well as normal moods and changes to life that is linked with your moods on a daily basis. On the opposite end is hyperthyroidism. People who experience this have the complete opposite symptoms. They may not be able to gain weight, and so they tend to be extremely thin. They may be hot all the time, just overheated. Like, you can give them or put them in an ice bath and it just feels good. This is just like normal for them because they generate so much heat, because their bodies tend to burn so much energy so fast that it doesn't retain any heat on the inside, and it doesn't retain any calories that are being eaten or stored. And so your body ends up eating your physical system, your physical body. So your muscles become smaller, your joints become a little bit weakened, your skin becomes less. It slowly over time takes away from your system. And so you become smaller and smaller and smaller. And if we don't control this, it can also take your life away as well. And so we don't want to be on either end of the spectrum. We don't want to be with an underactive thyroid or an overactive thyroid. We want to be euthyroid, which means we have normal thyroid function and normal thyroid hormones. So as I've mentioned so far, yes, thyroid disorders can lead to depression, especially hypothyroidism. But I can tell you also that we've seen depressive symptoms and changes with those who are overactive in their thyroid hormones as well, or those with hyperthyroidism. In order to know if you have a thyroid disorder, we often will check TSH, or your thyroid stimulating hormone, by your blood test, as well as free T4. Both of these numbers will give us a good picture as far as how your thyroid is functioning and whether or not it's balanced. Research has shown that your level of TSH is highly linked with your level of depression. So we know that if you have hypothyroidism and your TSH reflects that, the likelihood of you having depression is much higher, dependent on the severity of your thyroid disorder. The same happens with hyperthyroidism. And so if your TSH reflects that, your likelihood of having depression is based on that number. And so even a mild change in your TSH, meaning that you're slightly outside of the range of normal, we know that your depression can be very, very real because of that slight change. Let's talk about some statistics here. Research has shown that 31% of people with hypothyroidism has depression. Research also has shown that another 59% of people having thyroid disorders have depression as well. And so if it fluctuates back and forth, or you are normal now, but you are not normal because your organ changes, or you're not taking your pills or your medications as you should, the likelihood of going into depression is almost twice as high as those who just started treatment or have been maintaining their treatment over time. And we know that at least a half of patients with any type of thyroid disorder may have a mood disorder as well. So overall, mental health risks and changes are highly influenced by your thyroid organ function, as well as maintenance over time as well. So what do we do about this? How do we make things better for you? We can do things that you can try today to get this ball rolling. The first is to see your provider, make sure that you know and get a diagnosis, start medications if necessary. Thyroid disorders is one of those dysfunctions that will need some support that comes from medication. And so there are times where we can holistically care for you 100%, and times when we need Western medicine to work with you. And so talk to your provider, get the medication dosage correct. Make sure that you're testing regularly so that you can know where your TSH and free T4 levels are to make sure that they're in a good range. And once we have that all squared away, then now we should see a mental health provider, a behavioral health provider, just to make sure that we have somewhere to go to and someone to speak with to help us as we go through these depressive changes. And sometimes there could be a little anxiety in there as well, but they'll help us to process what is happening internally so that we can be on top of all the changes that may happen. There are more things that you can do outside of doing these two things. Seeing your doctor, seeing a mental health provider as well. Those are those two. But you can also make lifestyle and dietary changes that can help to balance your body as well. Specifically having to do with thyroid imbalances, we wanted to decrease alcohol intake. We want to decrease caffeine intake. We want to make sure that we're sleeping well at night because sleeping helps to balance our hormones. We also want to make sure that we're moving and exercising regularly because that helps us to balance our overall hormonal state internally. And so sometimes I know that it could be challenging when we're looking at all of these things and we're trying to organize them in our lives. And so I'm here to help you with that. If you would like some assistance with this journey and this process of learning how to balance your body and learning how to organize a schedule so that you can exercise and do the right exercises to help your body as well as eating well to help your body, I have a highly discounted program that I'm offering you today. I'm offering it to you because you're watching and you're here and you'd like to learn, but I want to help you on this journey as well. And so to get access to this program, it's called the Madam Estrogen Mastermind. It is hugely discounted at the link below this video. And so if you're interested, or if you just want to know more about it, you can inquire by clicking that link, and I'll be sure to send you information and give you everything that you'll need to help you balance your body and balance your thyroid. Thank you so much for listening today, and I hope to see you next time.